Hi, my name is Stephen Canton. I'm a fourth-year medical student at the University of Pittsburgh School of Medicine, and I will be presenting reliability and discriminant validity of a checklist for scrubbing, gowning, and gloving. This project was done in conjunction with UPMC Magee Women's Hospital, Harvard Medical School, and Magee Women's Research Institute. So for introduction, surgical scrubbing, gowning, and gloving are integral skills necessary to participate in surgery. However, these skills are difficult for medical trainees to learn due to the fast pace of the operating room, the limited time and availability of expert medical professionals to provide training, and the pressure of the high-stakes clinical environment of the OR. Such factors impede training skill acquisition and increase trainee stress, which negatively impacts the learning environment in the OR. Simulation-based education is rapidly gaining momentum, aligning with the paradigm shift in medical education as we transition from passive to a more deliberate practice model. A simulation model of scrubbing, gowning, and gloving can provide an opportunity to prepare students and mitigate stress while in the OR. Prior to developing the simulation or assessment tools, the content of the training that underlies the instruction must be formulated. Checklists are commonly used in medical education to evaluate clinical skills in a simulated environment. Checklists standardize procedural training, provide an objective assessment to track progression, and can be used as an assessment tool to determine competency or suggest remediation. Educational checklists have a high inter-rater reliability and training discrimination, which allow for quality feedback for the learner. Currently, there are no reliable or valid tools for evaluating a trainee's ability to scrub, gown, and glove, and the few published lack methodological rigor when describing the development of procedural checklists. In the first phase of this project, the modified Delphi technique was utilized to establish content validity and develop a checklist of 22 items for the process of surgical scrubbing and gowning and gloving, as you can see in Table 2. The objective of this study is to assess the validity and reliability of this checklist by assessing inter-rater reliability, internal consistency, and discriminant validity. We hypothesize that this tool will be able to detect a difference in skills between the learners with different levels of surgical expertise. For the methods, this IRB-approved study was conducted at an academic tertiary care institution. Participants were recruited and classified into 3 groups based on prior surgical experience. Novices were defined as preclinical medical students with less than 8 weeks of surgical experience, while intermediates were clinical medical students with at least 8 weeks of surgical experience. Experts were residents or fellows with at least 6 months of postgraduate surgical education. A convenient sample of 20 participants per experience level was determined based on institution feasibility and similar previously reported studies. Each participant was instructed to scrub, gown, and glove in an inpatient operating room. The participants were not given any instruction or guidance on the task, nor did they see the checklist prior to performing the task. 3 cameras were placed to capture the entire procedure as seen in Figure 1, including 2 outside the operating room at the scrub sink and 1 within the operating room. Individual videos were scored according to the checklist by 2 raters, who were blinded to subject's identity and prior surgical experience. Each rater watched the video and graded the participant's performance according to the checklist. The checklist is dichotomous with steps appearing as performed or not performed. To assess inter-rater reliability of the overall test scores, we computed the interclass correlation coefficient, or ICC, from a mixed effects model with random effects for the subjects. We also computed Cohen's kappa to assess inter-rater reliability for each checklist item. For the remaining analyses, we used the average of the reviewer scores for each participant. Chromebox alpha was computed to assess the relatedness of the checklist items or internal consistency of the test. For each item listed, for each checklist item, we calculated the correlation between the individual item completion and the test score to evaluate construct validity via Spearman's correlation coefficient. The Wilcoxon rank sum test was used to assess discrimination validity of the overall test scores between all pairwise combinations of the novice, intermediate, and expert groups. For the results, we recruited 56 participants for this study, including 18 novices, 19 intermediates, and 19 experts. Figure 2 shows that the proportion of times the checklist item was marked completed by each reviewer. The intra-class correlation coefficient was 0.990, indicating a high level of agreement between reviewers. The inter-rater reliability for each item, measured by Cohen's kappa, ranged from 0.598 to 1. Of note, 2 measures related to gloving were excluded, as they had no variation in completion. In Figure 3b, we can see that the internal consistency of the test measured by Chromebox Alpha was 0.950, indicating a high level of correlation among test items. Further, the correlation of each checklist item and the overall score ranged from 0.351 to 0.801, with the gloving measures also excluded from this analysis, seen in Figure 3b. The median test score was 9 amongst novices, 20 amongst intermediates, and 21.5 among experts, as you can see in this colorful figure all the way to the right in Figure 4. All groups differed significantly in the distributions of their test scores, showing that our checklist demonstrates discriminant validity. We found that our 22-item task-based checklist is a valid and reliable tool. It demonstrates a high inter-rater reliability, discriminant validity, and internal consistency. To our knowledge, this is the first study to develop and validate a consensus-based checklist for the skill of scrubbing, gowning, and gloving. This suggests that the implementation of this checklist would be effective for both learning and assessment. Medical students could benefit from a simulation model informed by the checklist at the start of their clerkships. Limitations of our study include a single center design, which decreases external validity. Use of a convenience sample can potentially introduce a selection bias if factors leading to participation affected the checklist performance. However, study participants were stratified based on experience alone, and the studies should be minimally affected by this sampling method. In conclusion, we demonstrate the development of a reliable and valid checklist intended to enhance medical education curricula, specifically to inform a simulated scrubbing, gowning, and gloving activity. There is also evidence that this can be used as an assessment tool within an OSCE or other standardized medical education curriculums. Future steps include further validation, including criterion convergent and predictive methods of the checklist, multi-center testing, and implementation into a medical education curriculum. That concludes this presentation. We would like to thank the numerous residents, fellows, and OR personnel for their time and assistance with this study. It wouldn't have been possible without them. Thank you for listening. Have a great one.